COVID cases are trending downward statewide. However, 3 Northeast Ohio counties remain at the medium level. Those include Erie, Mahoning, and Trumbull. Meanwhile, cases went from 18,000 to 16,000 in the last week, with a 17,000 3-week average. Hospitalizations and ICU admissions both dropped as well. And yesterday, an FDA panel approved the COVID vaccine for the youngest among us, kids 6 months to 5 years old. Today, the Ohio Department of Health discussed what parents need to know. Senior health correspondent Monica Robbins joins us now to break it all down. Monica, a lot of parents have been anxiously awaiting this. Some parents still on the fence here.
Yeah, and it's understandable, too. ODH Director Dr. Bruce Vanderhoff made a point today saying there's a reason we waited so long to get the vaccine for the youngest among us. They wanted to make sure the safety data was in and the benefit outweighed the risk. Now, the vaccine was given the FDA panel thumbs up for kids 6 months to 5 for both Moderna and Pfizer yesterday. The CDC will discuss it over the weekend and likely sign off, and those shots could become available by next week. Now, many parents are on the fence about getting the shot for their kids. 79,000 in this age group got COVID since the pandemic began in Ohio. 1,500 were hospitalized and 10 died in Ohio, 450 nationwide.
We are still seeing severe COVID in ineligible children, immune-compromised folks, and folks are still being hospitalized due to COVID. So we're not done. And so if you have an opportunity to prevent severe disease, that's the question. Can I prevent severe disease?
And it's important to remember these vaccines do not prevent anyone from getting COVID. They just prevent hospitalizations and deaths. And based on the state's numbers, the vaccines are definitely doing what they were intended to do. Still, a lot of parents have questions, and they are encouraged to talk to their child's pediatrician. That's also who will likely get most of these types of doses, because parents are more comfortable getting their kids vaccinated in a doctor's office. And some pharmacies aren't set up to vaccinate little ones. Typically, the age cutoff would be 4 years. And although these vaccines are not officially approved yet, they will be likely over the weekend. There's 700,000 kids in Ohio that would be in this category to get these vaccines.
Wow, so we just have to wait a little longer, though.
A little longer, and more importantly, if you have any concerns or questions, you got to talk to your child's doctor. They will have the answers you need. A lot of parents are worried about the Pfizer being a 3-dose regimen, and they're concerned that the kids won't be totally vaccinated by the time school starts. You need to talk to your child's doctor about those concerns.
All right, good advice. Monica, thanks.
Sure.